Okay, welcome everyone. Thank you very much for coming to this webinar about the research journey. And my name's Claire Roston and I lead the Research Design Service in Sussex. And I'm joined by my colleague Anya, who is letting people into the from the waiting room at the moment. So if you have any technical difficulties, she will be on hand to help with any of those. I was just going to quickly explain how we're going to work today. So if you'd keep yourself on mute, please, and do also feel free, if it makes you more comfortable, to turn off your video. The slides will be circulated to everyone after this, and we are recording this session, and those video recordings will be made available on our website shortly. So you will have a full kind of record of the session. We are hoping to get some level of interactivity. There's quite a lot of people going to be attending today. So what we're asking people to do is, if as the presentations go along, if you have particular questions you would like to ask, please do use the chat function. Ask your question that way. I'll be live on the chat throughout. I'll answer questions where I can. And if there are ones that would be particularly useful to address to our speakers, I'll ask them at the end on your behalf, and we'll have quite a long Q&A session at the end. So please do interact that way. So without further ado, I'm going to welcome our two speakers today, Dr. Catherine Evans, who is at Sussex Community NHS Foundation Trust and at King's College in London, and also Professor Cathy Greenwood, who is at Sussex Partnership NHS Foundation Trust and the University of Sussex. And they're very kindly going to share their experiences as academic and clinical people balancing a research career alongside an active clinical journey. So I will stop sharing and pass over to Catherine. Thank you very much.
Okay, thank you very much, Claire. Welcome everybody. It's very nice to see so many people joining us. I think we're up to 22 participants now, so that's great. So I'm just going to share my screen. I think if anybody has any problems that they can't hear, can you just put that in the chat or raise your hand, and then Claire and Anya can help support that. So as Claire said, I am a reader at King's College London, and I'm a nurse consultant in Sussex Community NHS Trust. My clinical practice and research is around palliative care, primarily palliative care for older people with multimorbidity and dementia. So I'm going to talk very briefly about my research journey, and my intention really is to stimulate some discussion and some thinking, share some top tips, and please do use the chat for comments and things that we can pick up with at the end. I'm very happy for people to email me after the presentation if that's helpful. So just to begin with, I just want to first of all just think very briefly about why is a clinical research journey important? Why as clinicians are we trying to stimulate your interest, trying to support you to pursue research within your clinical career? So I'm just going to draw on, this was some very nice set of publications that were in the Lancet back in 2014, which talked about the increasing the impact of research and reducing waste. And this is a box, a diagram that just shows the research journey and how, I'm just going to change my view, that's better, the research pipeline and how to reduce waste. And when you look at this diagram, you can see that there are very clear opportunities and then clear importance of researchers and clinicians to work together, and why there is such an emphasis on clinical academics. So of course, importantly, that we ask questions that are relevant to service users, so to patients and families. And often those questions are generated from clinical practice, from working with clinicians, from having an understanding of the clinical context. We need to design research studies that can be conducted within that clinical context. So again, working very closely with our clinical teams. We need to work in an efficient way to ensure the delivery of the research. And importantly, we need to write our research reports and our publications in ways that are mindful of the clinical context and are actually useful in translating those research findings into clinical practice so that we improve clinical effectiveness. And that is always our intention of conducting the research, is to improve clinical effectiveness and outcomes for patients and families. So in summary, the reason why we're talking about a clinical academic or a clinical research journey is to try and maximise the impact of our research for patients, for our healthcare system, and to ensure that the money we spend on health research is actually delivering what we intend. And secondly, is also just in thinking about the training that we have in research. So for all of us as clinicians, we've undergone extensive training to work clinically. We continue to maintain our clinical competencies and meet the requirements for our professional registration. So for us in research, simply would expect to have the training to be able to ask those important questions, design studies to answer them, and write and disseminate work in ways that are actually meaningful. And this is just quite a nice quote, again, from that series of paper from the Lancet, very much questioning why, as physicians, there is a requirement for such rigorous training and examination when the research can be conducted often with nearly no training. So the whole intention of this is, well, how do we actually ensure that we have the research training to incorporate research within our clinical practice? So now I'd just like to think a little bit about the opportunities to pursue research in a clinical career, and then talk a little bit about my own experiences. So this is just a slide just of my reflections, really, of the different career pathways that individuals have taken that are available to pursue research within clinical practice. And this is not all of them, this is just some of them and from my experiences. So just in looking and thinking about this, the different paths that people have taken, these are some of my colleagues from Sussex Community NHS Trust. So this is our NHS research and development or research and innovation team. So increasingly individuals coming through as clinical research nurses, clinical research practitioners, and their funding is through the Clinical Research Network. So this is often quite a good way of people gaining more research experience. The other picture here is a colleague, Dr. Jenny Parry, who was a paediatric dentist within the trust, who very much began her research career as a principal investigator, so supporting the delivery of research studies within the community trust. That experience enabled her to then increase her expertise, to be able to go on and lead her own research work. She has now moved and was promoted to a position as a clinical academic back in Ireland. So it's a nice example of how you can begin your research career through being a principal investigator within your NHS trust. And then below Jenny is another colleague of mine, Professor Patricia Krogot, who again has taken a slightly different career pathway. She is a nurse by background. Her academic work focuses on wound management. So she no longer works clinically herself, but she works very closely with the clinical teams, with the patient groups whom she's conducting the research with. And then there's me over on the bottom left-hand corner, and another different pathway of a clinical academic, very much supported by the NIHR Integrated Clinical Academic Pathway. So just thinking a little bit about my journey. So this is quite a busy slide in trying to sort of think through, well, how did all of this begin? Where did I start? And again, sort of reflecting on that for others to, I suppose, learn from or share messages. So like most of us, I began with a degree in community nursing. And that and bottom part of the slide is just reporting really my initial research training. So a degree in community nursing and then an MSc in gerontology. And when I reflected on this research training, one of the things that I think is really important to convey is about publishing your work. So at each of these stages of my research career, I published my dissertation from my undergraduate degree, I published my dissertation from my master's degree. And also importantly, in working clinically, at that time I was working as a health visitor, and I got involved in what would now be considered quality improvement projects. So getting involved in those sorts of steering groups, and again, looking for opportunities to publish that work. So I undertook some work around allocation of resource and health visiting, and we published that within the Nursing Times and presented that at the RCN conference. So quite small publications, but really important at the beginning, that you're beginning to demonstrate your ability to write, your able to demonstrate your ability to have ideas, to pursue them, to take those forwards and to disseminate those to inform clinical practice. So from an MSc, I then moved on and sought funding for a PhD. And what's important from this is that over on the left-hand side, that my first attempt at PhD funding, and this was at a national level, so this was applying to the Department of Health. So you can see my age, this predates the NIHR, so this was who you applied to before we had the NIHR. And my initial attempt at securing national competitive funding for a PhD failed. So I was invited to interview, and if you're invited to interview, it means on paper that you are fundable, but I failed at interview. And what I learned from that was that I was ill prepared, was that I had never ever competed for anything at a national level. And I was probably quite naive in my preparation in attending that interview. So I then applied again, and then was much better supported. So at that point, I had been able to secure an internship at King's College London. That internship enabled me to work up my doctoral application to a much higher standard. I was also given much more preparation for the interview. So mock interviews, coaching from my mentors, and I was then successful in my second attempt. And again, the message also from that PhD work is to publish your findings, so that these sorts of opportunities act as springboards to the next level within a clinical academic career. So my next part after my PhD was I had a bit of a stint working postdoctorally at King's College London in the Cicely Saunders Institute. Within that role, I then proposed that I would like to move to be an independent researcher, and was supported to do that by my line manager, Irene Higginson. So I then looked to pursue and move back into a clinical academic career. And at this point, the opportunity for clinical academics who were outside of medicine and dentistry was only really just opening up. So I had been outside of clinical practice. I then approached NHS Trust with a proposal of my research work and a joint role, and Sussex Community, to their credit, supported me with the application and agreed to be my NHS Trust. And I think also for them at that point, they were probably quite far ahead as innovators in doing that they didn't really know what a joint clinical academic post in nursing would bring, but they felt it was a good opportunity and that they wanted to pursue it. So my clinical lectureship work focused on new models of palliative care for older people with frailty and multimorbidity. And this built on my publications and collaborations from my doctoral work, and that clinical lectureship work led to more publications, increased my network, began to build my reputation in my field. So basically I was looking to position myself well to be able to progress to a senior clinical lectureship application. So my initial senior clinical lectureship application, again, I got through to the interview stage, and again failed at interview. And some of the feedback that I received was that they felt that I was insufficiently prepared for research leadership at that level. So again, I decided to have a second go. Again, I was probably better prepared with my mentors, both in writing the application and preparing for the interview, mock interviews with the RDS on my second attempt. And on that attempt, I was then successful. So my research work for my senior clinical lectureship that I'm currently undertaking is around managing clinical uncertainty for people with frailty and multimorbidity using our community hospitals. And again, this work is publishing, so one of the main publications from it is in Millbank Quarterly, so one of the top journals in public health. We're now working up the other publications from the work that has completed. And what that senior clinical lectureship has enabled me to do was to then move up to, if you like, to the next level, which has been able to secure a programme of research funded by the ESRC/NIHR. So this is a 5-year programme in collaboration with colleagues at UCL, and I'm the co-chief investigator on this work. So this programme of work is very much around palliative care for people with dementia. And for me, what's been important about the programme and throughout my career is around building research capacity, particularly in nursing and with allied health professionals, and also in the priority under-researched area of palliative care. So as part of that journey, it's been about building a cadre of individuals who are undertaking PhDs. So within our ESRC funded programme, we have 5 PhD fellows. And we also have postdocs who are leading the work streams to enable their transition to be independent researchers. And so within my programme has also been about supporting others. So for example, other NIHR awards of the PCAFs, the Preclinical Academic Fellowship, which is the bridge between master's and doctoral programme, and also their Knowledge Mobilisation Fellowship. So my journey has enabled me to support others just in the way that I have been supported and mentored by the individuals who've enabled me to progress from an undergraduate in district nursing and health visiting through to a reader in palliative care. So just continuing my journey, I just want to talk very briefly, just to give you a sense of some of my research work around my current one of my main programs. So this is called Embed Care. So this means empowering better end of life for dementia care, and this is the work funded by the ESRC. And when you look at this slide, you can see the sort of the breadth of work that is involved in a program of research. There is a huge team of us who are working to deliver this. And you can see when you look along the bottom of this slide, the different work streams that we're undertaking. So the initial systematic review and policy review work to underpin our intended model of palliative care for people with dementia, using existing routing data, prospective cohort study to understand needs of people with palliative care, with the intention that this then enables us to design our model of care through processes of co-design, and to be able to pilot and evaluate the feasibility and then onto the effectiveness of delivering palliative care for people with dementia in this way. And now what I'd like to think about is just, I think one of the key characteristics of what I've tried to achieve and what working as a clinical academic enables is very much around the message of adding value to research. So right back to my first slide about increasing the impact of research and reducing the waste. So my research work and my clinical practice focuses very much on transforming care in community settings, and also through my research work, building clinical practice, my role as an educator and as a leader. And what this slide is showing in the middle, just detailing my focus of research on palliative care and ageing, and then the different levels that I've moved through on my journey. So as I said, beginning with my clinical lectureship, undertaking a trial called OptCare Elderly on optimising palliative care for people in the community, and then detail below around some of the outputs and publications from that work. And again, the messaging here is about each stage is that then very much acted as a springboard to enable me to progress with my senior clinical lectureship, which, as I said, was around managing clinical uncertainty for older people in community hospitals, with very much an intention to improve our care processes of assessment and communication with families using existing validated tools, and some of the publications from that work, and how these two then enabled a springboard to being successful in attaining a programme grant. And then again, just detailing below that is one of the first publications from that work, which is of the protocol. So I've just put at the top of this slide, this is just a link to my portal, so at King's College London, which details all my research grants and publications and my PhD students. So I think it's just helpful for people to have a sense of, well, who am I? What does my work look like? What might be those publications that individuals are interested in following up? So one of the most important messages from my presentation is that in pursuing particularly an integrated clinical academic career through the NIHR, is that this is a highly competitive process. And to support that highly competitive process, the NIHR have some fantastic resources. So namely the RDS, who are obviously presenting this seminar today and have a wealth of resources on their website. But to give an indication of how competitive it is, within the NIHR website on the Integrated Clinical Academic Career Programme, they have this table which is reporting the number of applications that they've received since they started these rounds in 2015 and the success rate. And when you look down these columns, you can see that the success from actually submitting to being awarded is about 25 to 30% success rate. So that's how competitive those awards are at doctoral funding. And at the other levels of clinical lectureship and senior clinical lectureship, it is a very similar story. So I would urge you that if you are interested in pursuing particularly the ICA programme, is to look on the NIHR website. They have very useful resources and tailored to different disciplines. So for nurses, allied health professionals, dentists, medical doctors, that talk through their different programs of support. So a couple of take-home messages for me in my last 5 minutes. So in terms of research training, build your skills, as I said at the beginning, starting with things like being a site principal investigator, quality improvement projects, seeking opportunities to publish and disseminate those. And all of that is about building your academic training and a track record. Ask important clinical questions. There are things like the James Linda Lance Priority Setting Partnership. It's always well worth looking at those to see if your area of interest, your specialty, if there has been a James Linda Lance Priority Setting Partnership. So for example, there is in palliative care, there is, for example, in neurological conditions. I also think for me that the message around the importance of collaborators and mentors, your supervisors, and the way that you're supported, those individuals are absolutely essential to enable your success. And then always asking those important questions, but always thinking about the robustness of the study design. How is that design going to answer your aim and objectives? Is your aim justified? Is it clear? How will the research methods, is it convincing that they're actually going to answer your stated aim? And probably most importantly, what difference will the findings make? There's much more emphasis within the NIHR now around detailing a dissemination, impact and engagement plan within the research. The NIHR are very much looking for what difference will this make within 5 years. So they want to see that detail within the application. And all the way through my presentation, it's always about publishing and disseminating your work. And you can begin, as I did, in professional journals, and then increasing the caliber of your publications as you develop the quality and the caliber of your research work. Okay, so, and then finally, I'd just like to flag some key resources and opportunities. So I said one of the most useful resources and sites is on the NIHR's own website. They have this very useful page on career development, which talks through many of the opportunities that I have discussed. And they also highlight some of the many publications that have now come out around developing clinical academic careers. So some of these are specifically, so the one on transforming healthcare through clinical academic roles was aimed very much at chief nurses. This is a second document about building a research career. What does that look like? What are the opportunities? There have been specific documents around strategy for clinical research nurses, for allied health professionals. There have also been initiatives, again, for nurses called 70 at 70, which was a leadership program for nurses that was launched last year. And there are also things locally. So for example, our research champions, so within Sussex Community Trust, that's done. And then I would just like to say thank you. My contact email details are not there, but I can give you those. You can also reach me. Oh, no, they are there. So my email is there on my Twitter, and more information about me on my portal. And those are just some references of the resources that I've cited. So thank you very much.
That's lovely. Thank you so much, Catherine, for sharing your journey. I would just like to continue to encourage everyone, if you have questions that come up, please do ask them in the chat, and Catherine and then Kathy will be able to respond to you directly. I'm now going to pass on to Kathy Greenwood, who's going to talk about her journey. Thank you, Kathy.